65 years ago when Professor Brånemark was doing this, he didn't have the array of materials out there to make these teeth.
No.
And can you imagine, it was probably very difficult back then to actually, to start off designing the teeth that were going to last. And I'm sure you've seen that. You've seen the evolution of the materials that have been used in dentistry.
Yes, I mean, if you go back in the beginning, I mean, it was a little bit of a coincidence that Professor Brånemark did the innovation. He was doing studies on blood flow, and they used stainless steel chambers to actually insert on humerus and to see how the blood was flowing through these stainless steel chambers with glass in it, and you can see in live microscope. But they had a problem with inflammation, and then he found out that he should use titanium instead of stainless steel. And then they suddenly had no inflammation, but they had a problem to take the chambers out.
Yes.
And then he understood that there's something with this material, and then he went on and put it into bone as well, bone on dogs.
Yes.
That's how it works.
Okay.
It stays.
Yes.
And then they went on to humans. But you're absolutely correct that initially it was all about to place implants where the bone was. And then you had to figure out where the teeth came afterwards. And of course, the aesthetic results might not be, to say very diplomatic, were not always perfect. But I think that the evolution is coming. That like you were saying, that some patients need teeth. They want teeth, but sometimes they need an implant, because from a patient's point of view, it's always about teeth. And if you can use new technology, which you do, and I think it's important for patients to understand that when they think about this treatment, they should choose a clinic that has the tools to do what you are describing, that you can plan from tooth down and make sure that you get the teeth right, so it looks right, you can eat right. It's really key. But I just want to pick up on something else that you said, that you said earlier, that is, I think not everyone is aware that the demand for this treatment is not less now than it was 50 years ago because of demographics, because we are all living longer, which is a good thing. The bad thing is that there are more and more people that actually need implant treatment, and they might not always think about it. And I think that is also a task for a clinic like yours, to communicate to people what they really can get, how this will change their lives. And I can just say that everyone that is thinking about it should look for help and see what can be done, if they are a good candidate for this or not, and if they can do it. Because there is if you look upon the number of people that denture production, there are more dentures produced today than prior to implants coming into the market.
Wow. Okay.
Because of the change in demographics. So even if clinics are treating lots of patients, it doesn't mean that there's not a big need out there. It's huge. But as I said, I don't think all patients always think about it. I think this is just something that I get older, I'm gonna have dentures, but they should really look for going to a clinic like yours to see, how they can get help. And I think coming back to the planning, again, from a patient point of view, to look for help in the clinic that has the tools. And I think from a prosthetic point of view, what the demands in society today is that you want to come for treatment, but you don't want to wait too long until you get your teeth on implants. And I think that is something that you are working with as well, because you have all the tools in your practice, from not only a surgical point of view, but also from a prosthetic point of view, which is key.
Yeah, I totally agree. And I see this every day. Everybody's busy, and everybody leads a busy life. Everybody's has pressures in their life, financially, socially, and you're right. There's a lot of people out there that need this treatment. It's very, very much untapped in our demographic, and we're trying to change that. And it's all about communication. It's all about giving the knowledge to the people that this procedure is safe and can be done, and it's life changing for them. There's nothing more debilitating than having a missing tooth. You lose complete function of what you do on a daily basis. It's embarrassing. Unfortunately, there's a social stigma around
Yes.
having missing teeth.
Yes.
And we can't change that, but we can change that, the knowledge for the person and the predictability of the outcomes that we give on a daily basis. And this is one of the big things about New Life Teeth. It's a completely team approach, patient-focused team approach. You can't do this as a single clinician. You can't spread that knowledge and provide this treatment as a single person. So we have a system, we have a team in place that listen to the patient. We listen to what they want. We listen to their needs. And I think we're very good at that. You know, we have the right type of people at the right place in that journey. You know, we have empathy. We understand their concerns. People automatically, I feel, rule themselves out of a lot of things in life because they're anxious, they're nervous. They just find an excuse maybe not to do it. And we want to make sure that they're in the right place and they're listened to. And that's so important for us. And when you hear their story and their journey, they're no different than anybody else. But of course, it's very personal to them. And you know, from their clinicians to our treatment planners to our triage team on the phones to our financial people that deal with the cost of how we do things, we make that part of that journey very seamless for them. And you know, I think it's one thing that New Life Teeth do quite well. Of course, we can improve on how we do things, but it's one thing we do quite well. And ultimately, that journey from start to finish, we see the person change. It's incredible, the story, the life-changing moment when they've started, the relief. I think it's such a relief for a person when they know you can help them. You know, it's just like a weight has been lifted off their shoulders. It's incredible. You know, it's like once they found the solution out there, and once they're listened to, you know, it makes such a big difference for them, and the weight just completely. They're different people even before we start sometimes, but then of course the transformation. People don't realise that, you know, that your mouth is the centre of your face. It's the centre of your focus. Whenever we communicate with other people, of course, when we eat and chew, that's a big part of what your teeth function with. But it's also about sleeping properly. It's about speaking properly. It's just getting rid of that embarrassment. And we say to our patients, because it's always the usual things, I can't eat this, I can't eat that. There's more to it as well, but they say, I can't eat this, I can't eat that. And one of the things I joke with the patients, I said, once you have this, everything is back on the menu. Because we restore the function. And you don't have to have that embarrassment when you go to a restaurant and you're picking through the menu trying to choose the type of food that you want. Everything is back on that menu again. And you can eat and chew at ease. But then what's a part of the dentistry and a part of the rebuilding people's mouths for me is their ability for the jaw to be in the correct position for them to sleep properly. I feel like a lot of people out there today, we don't sleep. At a certain age of our lives, we lose we get sleep apnea, our mouths fall back, our tongues fall to the back of our mouths. And the part of restoring that function for me is also the ability to sleep properly. And when you sleep properly, you know, your life is so much better. You're more mentally aware, you're more astute, you function better as a human. And I think that's such a big thing for us as well. And that's all part of the planning. Anatomically, what we do today, there's very little, there are no cases I can think of that we cannot treat anatomically. Now, medically, we have some patients that have some syndromes and some conditions that do preclude them from this type of treatment. Again, very, very few. But anatomically, there are no conditions that we cannot treat. And everybody naturally assumes that they're complex and complicated. Of course, we're all complicated and we're all very unique, and everything we do is very customized for that individual. But it's one thing that I think stands us apart in New Life Teeth from our competitors, if I can say that. We have the ability to treat any anatomical situation. So any bone anatomy, we can find the anchorage for that implant. We can give you that fixed tooth again. And there's nothing more satisfying than having fixed teeth. There are lots of different options out there, as we know. You can give people teeth that are removable, that are clipped onto implants. but it's not the same satisfaction as, in my opinion, it's not the same result for that person.